Doctors Hospital boasts a comprehensive multi-facility rehabilitation program with a full range of services for patients needing therapy.
Here at Doctors Hospital, we do have physical therapy, occupational therapy, speech therapy, exercise physiology, and massage therapy services. So we tend to customize the services to suit the patient. So whatever you need, we are able to provide, and if we can't provide it, we'll help you to find the help that you need.
Exercise physiologists customize exercise programs for patients.
We have a team of wonderful exercise physiologists here. They're very highly trained. Some of them are trained in cardiac rehab, and what they offer for us is a customized exercise program. And in persons with medical conditions, they can't do the run-of-the-mill personal training. So our exercise physiologists, that's where they play a big part. They customize exercises for persons who have had serious medical issues. And, we have our senior fitness program that they commandeer. They also do lung function assessments. They do, as I mentioned, they're integral in our cardiac rehab program, right? So, they do whatever you can think of in terms of exercise and maintaining a happy, healthy cardiovascular system.
Doctors now offer services at 2 locations.
We now have our new Cable Beach location. And as you know, we all like new things. So it's well outfitted with all the things that you've come to know for Doctors Hospital, the high-end equipment and the specialized treatments. So it is located in that Super Valley Plaza. That's what people tend to call it, Cable Beach. We're right beside Wendy's. And, it's pretty easy to find. And we offer a variety of services. We treat our kids here. We treat our older patients here. Any particular condition, we can accommodate it at our Cable Beach location.
Speech and language therapy is also offered by Doctors Hospital.
Speech and language therapy is needed when a person has a speech impediment or they may have a swallowing disorder, which is developed maybe during childhood or as an adult after having a stroke or a brain injury. I work with patients on a one-on-one basis, so their goals are individualized. Depending on their goals, it might be articulation. In that area, we work on age-appropriate sounds. The child might be delayed in sounds that are appropriate for their age. With adults, most adults may had a stroke. With that comes dysphagia, so that's a swallowing disorder. They may not be able to tolerate regular food and liquids. So we kind of work on oral motor exercises and what we call per oral, PO trials, to kind of find out what texture and what diet they should be placed on.
Krista has seen great success with patients.
There has been so much great moments, I would say, success stories where working with kids and adults, because it's kind of a wide range, you see a lot of kind of highs and lows. So I would say the most success is seeing my kids, especially kids that are on the spectrum disorder, autism. They tend to come in, nonverbal kids I've seen, and you've seen progress. It may be slow, but being able to express their wants and needs, I've noticed that to be my greatest success, being in this field.
Other specialty services include home care and cardiac rehab.
So as well as offering our on-site treatments, we have the option for home care. This is where we provide concierge services. So we come to your home, or in some cases we come to your office, just depending on where you need the service. And we meet you there and we provide a detailed assessment and treatment just as if you were on site at any of our locations. Our cardiac rehab program is a very specialized program, and it involves several groups of individuals. So we have or physical therapists or exercise physiologists or pharmacists or psychologists and or nutritionists. So it's a multidisciplinary team that comes together to curate a program to help you post heart, any injury or disease to your heart. So for example, if you've had a heart attack or myocardial infarction, these are things that they would help you to rehab for. So it's a streamlined program where we enroll you for about 3 months, and you get a customized program built to help you to address all your physical function, as I said, the your nutrition, making sure that your medications are not playing a negative role in what we're doing at the time. So it's very tailored and sensitive to the needs of persons with a cardiovascular, post a cardiovascular event.
There is also a uniquely tailored program for post-COVID patients.
So our post-COVID rehab program is geared at treating persons who have had COVID and now suffer from long-term effects. So, they call it long COVID. And with that treatment program, what we do is customize it to the patient. So, for example, if you've had any speech impairments or any issues with voice or any issues with just swallowing, that kind of thing, secondary to being on a ventilator for a prolonged period of time, we do offer that treatment. If you have mental issues in terms of you can't concentrate, you have a poor attention span, you are unable to focus, or occupational therapists help to treat that type of condition as well. Or physical therapists, as you know, we treat the respiratory system as well as the cardiovascular system. So we look at any breathing problems you might have lingering, that shortness of breath, that uncontrolled breathing pattern, that anxiety. We help with that as well, just to make sure that your lungs are working at their optimal. And we also help you we customize the exercises for you, because most persons post-COVID think, okay, I should just go ahead and do and strengthen and do all these kind of exercises, when we've recognized that that's not the best way to go. It has to be a customized program where we show you how to actually slow down and make sure that you're doing just enough and no more, because that can exacerbate your symptoms.
Speech and language therapy plays a big part in persons that have had COVID. It helps with regaining communication skills that they may have been impacted due to being placed on a ventilator for a significant amount of time. Those that may have low oxygen levels to the brain may have experienced muscle weakness and reduced coordination in their articulators. So that is our lips, our tongue, our jaw, and our cheeks.
Doctors Hospital is a state-of-the-art one-stop shop for comprehensive care.
What I've realized is that Doctors Hospital still has, one of the greatest teams of therapists. And because we offer speech, we offer occupational therapy, we offer physical therapy, exercise physiology, and massage therapy, it's a very comprehensive program. It's a one-stop shop facility. You get everything that you need here. And if you need additional services, we have our pharmacists, we have our nutritionists, we have our medical team, so it's a very comprehensive facility. And of course, we have state-of-the-art equipment, and we're very forward-thinking, and, our leader, Dr. Digges, has been very adamant about that. He wants us to think for the future and think about how best we can develop our patients and also develop ourselves, and that's a win-win combination, and so the patients will actually do better for it.
For Bahamas at Sunrise, this is Suzette Parker.